let's continue the discussion of balance method of Dr. Tan. The most easiest system, but very much effective. So whatever you are going to learn today, you start applying this technique. Whether you use needle or you do acupressure or you put the magnet, the system is going to work. Either you do treatment in the body points or in the sujok points, this system is going to work, right? So just apply this. So let's continue the discussion of, and I hope you have learned the name of all the Chinese families. So these are the names of all the Chinese families. Tai Yin. The meaning of Tai Yin means lungs and spleen. So whenever I asked you Tai Yin, what is Tai Yin, you have to tell me lungs and spleen. Shao Yin. The meaning of Shao Yin means heart and kidney. Zuin. The meaning of Zuin means pericardium and liver. Right? So we have to remember this name. And the same way when we talk about the Yang Ming. The meaning of Yang Ming means large intestine and stomach. Taiyang. The meaning of Taiyang means small intestine and urinary bladder. And the meaning of Shaoyang means triple worm and the gallbladder. You need to remember these all names: 1, 2, 3, 4, 5, and 6. These are called 6 Chinese families name. And we can see all the meridians are here. We can see the 6 Chinese family and all the 12 meridians, right? So now we'll proceed from here because we have completed yesterday till this point. Now let's discuss the formula of Dr. Tan. The Dr. Tan has given 3 rules. Rule number 1, find out the sick meridian. One person is telling, oh, I am having wrist pain. My pain is here in the wrist. So pain is here on the location of heart 7. This is the location of the heart 7. I already told you, you have to keep the chart of all 12 meridian in your clinic or on your table. Patient is telling you, I'm having pain here. Okay. This is the location of heart 7. So now we found, wonderful. The patient is suffering with a pain in heart meridian, diagnosis completed. Rule number 1 complete. Let's move to the rule number 2 of Dr. Tan. So now rule number 2 of the Dr. Tan. What is the rule number 2? Rule number 2. Because there is a 1, 2, 3 formula. Resolve the problem within the family. Resolve the problem within the family, right? I will show you here. So number one, 3-step formula, find out the sick meridian. We already found heart and the pain on the location of heart 7 on the wrist. How to treat? Now search the meridian, who will treat, who will balance it. Then who is going to balance it? Now we have to, the Dr. 10 is telling who will balance it. So as per the rule, Dr. 10 first concept, when you are in the trouble, first you try to resolve matter in your own family. Don't take the support of anyone else, right? If you are suffering with the problem, you are in the trouble, resolve the problem within the family. This is the first concept of Dr. 10. What is the meaning of this? The meaning of this, we already know we are having 6 families: Taiyin family, Shaoyin family, Zuin family, Yangming family, Taiyang family, and Shaoyang family. So if the problem in the Taiyin, just resolve in Taiyin only. Don't take the support of anyone else. If the problem in the Yangming, just resolve the problem in Yangming only. Don't take support of anyone else. So wherever the problem, just finish there only. Right? So for example, someone is having problem in the lung, right? Lung means Taiyin. We know lungs and spleen. So someone is suffering with a problem in the lung. So resolve the matter in the family only. So who will treat? Spleen will treat. We can take the support of spleen because lung and spleen is one family. Okay. Now problem in the heart, we know. So don't take support of anyone. Heart belong to Shaoyin family. Heart and kidney, both are Shaoyin. Just take the support of kidney. Kidney is within the family. In the same way, anywhere problem, just resolve there only. Problem in the pericardium, treat by liver. Problem in the large intestine, treat by stomach. Problem in the small intestine, treat by urinary bladder. Problem in the triple wormer, take the support of gallbladder, and vice versa. So Taiyin problem, the problem in the Taiyin means the problem in the lungs. Suppose someone is suffering with a cough, cold, asthma, treat by spleen points. Or I will show you the image of meridian for clear understanding. The person is having the problem in the lung meridian. We can see this is the lung meridian. We know lung, this is the lung meridian, lung meridian. So a person is telling, okay, I'm having elbow pain in the lungs. I'm having wrist pain here. I'm having pain in the palm here. Okay, you are having problem in the lungs. So we have to resolve the matter within the family. Okay, so take the support of spleen. If the problem in the lungs, take the support of spleen. So this is the rule number 1. The problem in the Taiyin means lungs and spleen. If the spleen in problem, treat by lungs. If the lung is in problem, treat by spleen. So where is the spleen? So if there is a problem in the lung, we will see where is the spleen. Spleen is here. Spleen is starting from the legs. So we'll treat somewhere. Where we'll treat, we will discuss shortly. Spleen meridian. So problem of the lung will be treated by spleen. This is the concept number 1 of Dr. 10. Let's take one more example. If the problem in the Shaoyin means heart and kidney. So problem of the heart, will be treated by kidney. The problem of the kidney will be treated by heart. So the problem in the Shaoyin, you have to resolve the problem within the family. Don't take support of anyone else. It is the concept number one. So we found our patient was having problem in the heart. 7. Who will treat? Kidney is going to treat. Right? In the same way, if someone is having problem in the Zuin, what is Zuin? Zuin means pericardium and liver. So problem in the pericardium will take the support of the liver. For example, let's see the pericardium. One person is telling you, oh, can you treat my wrist pain here? Okay, this person is having wrist pain at the location of pericardium 7. This wrist pain is very common in one disease. That disease is called CTS, carpal tunnel syndrome. In the carpal tunnel syndrome, there is a compression of one nerve, median nerve. The person is having pain here. This pain might go to the finger, but this pain is here at the location of pericardium. Okay, the pain in the pericardium, where will treat? As per the Dr. 10, we will treat, okay, pericardium will treat in the liver. Okay, liver. So where we are going to treat now, we'll see the liver. Where is liver? So liver meridian is here. This is the liver meridian. We can see liver 1, liver 2, liver 3, liver 4. Liver meridian is this. So we are going to treat in the liver. In this way, one patient is telling you, okay, I am having ankle pain on the liver 4 here. Okay, this person is having ankle pain on the liver 4. Where to treat? So as per the Dr. 10, the problem in the liver will be treated by pericardium. The problem of the pericardium will be treated by liver. So if the problem in the liver at the ankle joint, at the location of liver 4, will take the support of pericardium. And we just seen where is the pericardium meridian. Pericardium meridian found in the arm. So we will treat in this meridian. We will shortly see where we'll treat. In the same way, if the person is having problem in the Yang Ming, and suppose the meaning of Yang Ming means large intestine and stomach. So person is telling you, I am having pain on the knee in the stomach meridian. Who will treat? Large intestine will treat. Let's see in this image. This is a very common problem. The person is suffering with the knee pains. Many times a knee pain in the front side of the knee. Where to treat? We will treat in the large intestine. So large intestine is here. Large intestine is in the arm. So this is the location of large intestine. We can see here. Large intestine 1, large intestine 2, large intestine 3, 4, 5, 6, 7. So the problem of the large intestine will treat in the stomach. The problem of the stomach will treat in the large intestine, vice versa. So these both channels will be treating each other, right? LI will be treating ST and ST will be treating LI. Both channels will treat each other because both belong to one family. This family is called Yang Ming. So resolve the matter within the family. Don't take support of anyone. In the same way, someone is suffering with the problem in Taiyang. The meaning of Taiyang means small intestine and urinary bladder. Okay. The meaning of Taiyang is this. the small intestine and urinary bladder. The problem in the urinary bladder will treat in the small intestine, and we know here, look at the urinary bladder. Urinary bladder is a very big channel. This is the urinary bladder. And it's very common, many persons suffering with the pain in the knee on the backside. This is the urinary bladder. This is also the urinary bladder. If the problem in the urinary bladder, where we are going to treat, will treat in the small intestine. So where is the small intestine? We should know the root of the meridian. So this is the small intestine, we can see in the arm. So we are treating somewhere. We know the small intestine 5, small intestine 8. There are many points in the small intestine. Somewhere we are going to treat. Where we are going to treat, there is the next step. In the same way, Saoyang, the meaning of Saoyang means triple warmer and the gallbladder. The problem of the gallbladder, we are going to treat in the triple warmer, and we know it's very common. Some person is suffering with the problem in the gallbladder, and we know many persons suffering with the hip pain. Hip pain is very common here. Someone is having hip pain, buttock pain, or the sciatica pain who is starting from here. Okay, problem in the gallbladder will treat in the triple warmer. Why? Because gallbladder and triple warmer belong to the same family. So triple warmer and gallbladder belong to same family, Shaoyang. So reserve the matter within the family. Don't take support of anyone. This is concept number 1 given by Dr. Tan, and it's a very amazing concept. Okay, now, so we are coming back to our this concept. What is the concept? Our patient is having pain at the location of heart 7. So who will treat? Kidney will treat. Because heart will balance the kidney and kidney will balance the heart. Because both belong to Shaoyin. So wonderful, now we found the kidney meridian who is going to treat. So 1, 2, 3 formula. Who is sick? Heart meridian is sick. Who will treat? Kidney meridian will treat. Wonderful, kidney meridian will treat. But kidney meridian is very long. Where to treat? Kidney meridian is starting from the feet. Then it's traveling a long path, and kidney meridian having kidney 1 to kidney 27 point. Too many points where to treat, because we have to treat just a wrist pain. Now this is the challenge. We found that meridian, but now challenge is this, we have to treat. So now will be again, Dr. Tan has given 1, 2, 3 formula. 1 means heart meridian is ill. 2 means kidney will treat. The 3 will tell you where to treat. So where to treat? Okay. So now will be the formula number 3. Now will treat as per image or the mirror. I will tell you what is the meaning of that. Like this lady looking the mirror, both looking same like each other. Okay, this looking like this and this looking like this, everything looking like same. Both hands looking like same. So this is the right hand and this is the left hand. Both hand looking like same. So this is called mirror or image. Right now I'm not doing the differentiation in the mirror and image. So I can tell thumb looking like thumb of other hand, index finger looking like index finger of other hand, middle finger looking like middle finger of other hand, ring finger looking like ring finger of other hand, small finger looking like small finger of other hand. So this concept is called mirror or image. Right? In the same way, both feet looks like same to each other. The great toe look like great toe. The index toe look like index toe. So each and every toe, respective toe, looks like the other respective toe. So this is called mirror or image. If you are having the problem here, we can treat here. This is called mirror concept. If you are having the problem here, we can treat here. If you are having the problem here, we can treat here. This is called mirror and concept, mirror and image concept. So not only this, the hand look like feet. So thumb is looking like the great toe. This is called mirror and image system. Index finger looking like index toe. Middle finger looking like middle toe, ring finger looking like ring toe, small finger looking like small toe. This is called mirror and image concept. It means if the person is having problem in the thumb, we can treat in the great toe because both are looking like same. In the Dr. 10 balance method, there is a one thing, we never treat sick meridian. If the person is having sickness, we don't touch that meridian till the formula number 5. If the person is having the problem in the heart, will not touch the heart meridian, will treat somewhere else. If the person is having problem with the index finger, will treat in the index toe. This is called mirror and image. So look at here. So these are the right hand. This is the right hand. And this is the left hand. Both look like same. So right finger looks like the left finger, right hand look like the left hand, right wrist look like the left wrist, right forearm look like left forearm, right elbow like left elbow, right upper arm like left upper arm, right shoulder like left shoulder, right top of the shoulder like left top of the shoulder. This is called mirror format of arm with arm. So person is having problem here, I will treat here. On the other hand, person is having problem in the elbow, I will treat here in the other elbow because both are same. This is mirror and image concept. I will treat in the area which look like same. If the person is having problem in the shoulder, I will treat in the other shoulder. Same for feet. If the person is having problem in the leg, we can see here. The right toe or left toe look like same. The person is having problem in the right toe, I will treat in the left toe. The right foot like left foot, the right ankle like left ankle, the right lower leg, the left lower leg, right knee looks like the left knee, right thigh look like the left thigh, right hip joint looks like the left hip joint. So in this way, if the person is having problem the right knee, I will treat the left knee. Person is having problem the right ankle, I will treat the left ankle. This is the mirror and image concept. And in the same way, we can also compare arm with the leg. How? The finger look like toes. We can see. The finger look like toes. If the problem in the finger, I will treat the toes. The hand look like foot. If the problem in the hand, I will treat the foot. The wrist look like ankle. So we can see here. These look like same. So we know there are lots of problems suffering with the wrist problem. Wrist. Will treat the ankle. For the wrist, where will treat? Will treat the ankle. For the elbow, will treat the knee. For the knee, will treat the elbow. So our person is having pain in the wrist. Where will treat? Will treat in the ankle joint. Right? So upper arm look like thigh. The shoulder look like hip joint. In the same way, this is called mirror and concept. So the pain of the heart 7, we will treat at the kidney 3. Let's see why. Why the kidney 3? So pain in the heart 7. So this is the heart 7. So as per the doctor 1, 2, 3 formula, 1, 2, 3 formula. 1, find out sick meridian, heart meridian. Formula number 2, who will treat? Same family, within the family. So we know Shao Yin means heart and kidney. Who will treat? Kidney will treat. Formula number 3, where to treat as per mirror and image concept. So either we are going to treat in the other wrist or the ankle. Only two possibility till now, because till now we have understood this much only. Either we can treat in the other wrist joint, the wrist of the other hand, or we can treat in the ankle joint. Only two possibility. So we'll treat either in the other wrist or in the ankle as per the mirror and image. But we have to treat in the kidney. So let's see the kidney meridian. Where the kidney meridian? So this is the kidney meridian. And this is the location of kidney 3. I will show you in the other image for clear understanding. Kidney meridian. We want to treat the pain of the heart 7. Now we'll treat in the kidney meridian. So we have to treat at the same location exactly. So because look at this is the kidney 3. Exactly. We know this is the medial malleolus, and just inside this is the location of kidney 3. We are going to treat here. And if we see, this is exactly like the wrist joint. So we'll put the needle here. We can do the acupressure here, or we can do the acupuncture here. And what do you think? How long time it will take? If exactly pain in the heart 7, you put the needle in the kidney 3, how much time it will take? Tell me. If the person is having pain, how much time it will take? Only few seconds. Pain will disappear. This is the beauty of Dr. Tan. Needle in, pain disappear immediately. If your diagnosis is perfect, that pain in the heart 7. If pain is somewhere else, then it's a different condition. It will take friction of side. We can also do one thing. We put one needle on the kidney 3, one needle little up and down, because like maybe pain not exactly on the heart 7, maybe little here and there. So put one needle on the kidney 3, one needle 1 centimeter or 1 tune up, one needle 1 centimeter, 1 tune down randomly. Pain will disappear. So this is called 1, 2, 3 formula. The 1 means find out sick meridian, that is heart. Who will treat kidney? Where to treat mirror? Mirror means ankle joint, kidney 3. Let's see the other point. Multiple example so that you can make the formula. It will work on the paralysis also, but for that you have to, for the paralysis, we have to make the global balance. Because in the paralysis, we are not treating one single part. We have to treat entire big area. Right? But definitely it will work, even for the paralysis. The most important thing, we have to treat on the opposite side. Remember this, we have to treat on the opposite side. Right? Even we can treat the same side, but don't worry. the concept of same side and the opposite side is coming, and we will be discussing at the last, because there are 5 concepts. We are right now we are discussing concept number 1, then the concept number 2, then the concept number 3, then the concept number 4, 5, and even 6. And the concept number 1 we treat on the opposite side, contralateral side. If the pain in the right side, we'll treat on the left side. Let's take the example of the pain in the gallbladder 40. We'll treat by the triple Warmer 4. I will explain this concept now. The pain in the gallbladder 40. I am writing this, but patient will not tell you. Patient will tell you, doctor, I'm suffering with a pain. Okay. I will ask, okay, tell me, where is the pain? He is telling, I'm having pain here, at this location, near about this part here. Not only pain, maybe skin disharmony, maybe some skin discoloration, maybe some nodule, lump, cyst, any disharmony if happening at this area. So this is the area called gallbladder 40. That's why you should have the idea of what meridian. So this is the gallbladder 40. You can see just this is. So now let's think as per the Dr. 10 formula 1, 2, 3. Find out sick meridian. Patient told, I'm having pain here. Okay, this is the gallbladder meridian. Done. Wonderful. Gallbladder meridian. 2. Who will treat? So resolve the matter within the family. Within family. Okay. Within the family, what is the meaning of gallbladder family? Who belong to the gallbladder family? So see about this chart. Now you can see in this family we have gallbladder. So gallbladder and triple Warmer belong to Shao Yang family. So resolve the matter within the family. The problem in the gallbladder, take the support of triple Warmer. The problem the triple Warmer, take the support of the gallbladder. Okay, wonderful. Now we find who will treat. Triple Warmer will treat. So triple Warmer will going to treat. The problem in the triple Warmer will be treated by the gallbladder. The problem the gallbladder will be treated by the triple Warmer. So who is ill? Who is sick? Gallbladder is sick. Who will treat? Triple Warmer will treat. Because both belong to one family, that is called Shao Yang family. Okay, triple Warmer. Wow, wonderful. We found the triple Warmer. Let's do the treatment the triple Warmer. But suddenly we found, oh, triple Warmer is very big meridian. We can see triple Warmer 1, 2, 3, 4, too many points. We have to treat. Too many points. Now the third concept, that is called the concept of mirror image. As per the mirror image concept, The finger looks like toes. The hands looks like foot. And this wrist joint look like ankle joint. So we are going to read ankle joint. We are going to read in the wrist because wrist and ankle looks like each other. This is called mirror and image. So we are going to read the point of triple warmer here. So this is the location of triple warmer 4. Let's see another image. So we are going to read where? In the triple warmer meridian, which is also called Sanjiao. Look at here. So this is the location, the midpoint of the dorsal wrist crease, triple warmer 4 or the Sanjiao 4. So triple warmer meridian coming from the ring finger, it's a moving, reaching on the dorsal wrist crease. We can see here. This is the location. As soon as you put the point here, the pain will disappear. We can also do one thing. So one point we can put here. One point we can put here. This is the triple warmer 4. We can put triple warmer 5 also for extra support. And pain will disappear immediately. So this is called formula number 1 to 3. Let's take the example of urinary bladder 60. We'll treat with the help of small intestine 4. How? Let's explain. Let's discuss. So the person is telling, I'm having pain in the ankle joint. I'm taking different example just to develop your concept because you can think yourself. This is the beauty of this system. So we can see one person is telling you, okay, I'm suffering with ankle pain, but now in the different location. Here, this is the location of UB60, bladder 60. Here. In the wrist, in the ankle joint, here is the bone. And the back side, this is the location that is called UB60. The pain is here, okay? So person will not tell you UB60, person will tell you, I'm having pain here in this area, or it's going down here, or it's going up here. Okay, so the concept formula number 1 to 3. Formula 1, 2, 3. Where, who is sick? Who is sick? This area is sick, urinary bladder meridian is sick. Okay, wonderful. Diagnosis is over. Diagnosis is over. Who will treat? Same family, resolve the matter within the family. Within family. Okay, so who belong to urinary bladder family? Let's see here. As per our this chart, if you see the Taiya means small intestine and urinary bladder. So Taiyang belong to urinary bladder family. Urinary bladder belong to Taiyang family. So resolve the matter within the family. If the problem is the urinary bladder, take the support of small intestine. Wonderful, we found the meridian who is going to treat, and it is a small intestine. So we found the sick meridian, urinary bladder. Who will treat small intestine? The question comes where to treat. Again, let's see the small intestine. Small intestine in the arm. This is the small intestine. So if you see, the wrist look like ankle joint. So the point of the small intestine here will be treating the problem. So which is the point here? We can see there is a point that is called small intestine 4 and 5. Just whichever the point is here, we'll put that point. Even we can put one more point here and there. So as soon as we put the small intestine 4, the pain will disappear. Let's see in this image. Let's see. So this is the depression here. We find this is the depression. This is called small intestine 4. We can see this is the depression below the bony part. We can see, we can feel the clear depression. And we can put the needle here. It's a wonderful point for, and it will treat the pain immediately. We can see. So let's take another example. The pain of the lung. I am taking multiple similar example so that you will understand. The pain of the lung 9 will be treated by the spleen 5. Okay, pain of the lung 9 will be treated by spleen 5. Where is lung 9? So if you see the lung meridian, this is the lung meridian. And this is the lung 9. So let's again bring the formula of Dr. 10. 1, 2, 3 formula. The one who is sick meridian. The answer lung. To who will treat? Then resolve the matter within the family. Now we have to find out who belongs to lung family. So we see here, this is a tie in lungs and spleen. So lung belong to thigh family and spleen is also belong to thigh family. We resolve the matter within the family. If the problem in the lung will treat by the spleen, if the problem in the spleen will treat by lung. So problem in the lung 9 will treat by the spleen. Let's see, this is the spleen. So spleen meridian found in the leg. So if we look at the leg, toes look like fingers, feet look like hand. And if we talk about the ankle joint, ankle joint look like a wrist joint. The person is having pain at the location of lung 9. Will treat in the ankle joint, will treat here at the ankle joint. Put the needle here, do the acupressure here, but where? So now let's see here. Here we are having one point that is spleen 5. Or even we can put the point up spleen 6. Whatever the point available here, whether the point or in between anywhere, just as per the image, as per the mirror, point exactly on the same area, but on the meridian, on the spleen meridian. Because spleen will balance the lung. Let's see the location of spleen 5 and we'll put the point here and we'll see the immediate balance. So if you look at here, we can see this is the depression below the medial malleolus. So we can see here. So we have to treat this point, or we can treat the point little up or down, but in the spleen meridian, right? So we are treating the, we can take one more point. We can take one more point, but we have to take the point in the spleen meridian. We know spleen 6 found little up, but it is, we have to take the point little up and down, but we have to take the point in the same meridian, right? So spleen 6 point found 3 tune up, but again I will repeat, forget the point. You can put the point on the spleen 6 or before that, right? So now the person is having pain at the location of LI5, large intestine 5. So who will treat? Stomach 41 will treat. How? The person is having pain at the location of LI5. This is the LI. LI5. So again, as soon as we get the okay, pain in the LI5 on the wrist. So we'll bring the formula of Dr. Tan. 1, 2, 3 formula. Who is sick? Large intestine. Who will treat? Resolve the matter within the family. So large intestine and stomach belong to one family. So we have to take the support. If there is a problem in the large intestine, we'll take the support of the stomach. So we can see here. Yang means large intestine and stomach. If the problem in the large intestine, will take the support of the stomach. If the problem in the stomach, will take the support of large intestine. So now we are having pain in the LI5, will take the support of the stomach. So stomach will treat. So let's see the stomach meridian. This is the stomach meridian. Very long. So now we are to treat. If you see here, the ankle joint look like wrist joint. So we'll treat the stomach point here because stomach will balance LI. Both belong to Yang Ming family. So which is the point here? We can see this is the stomach 41. So as soon as we treat the stomach 41, we'll see the balance. So this is called balancing method, right? Stomach 41 we'll put here and we'll see the wonderful balance. And the pain of the LI5 will, we can see the depression here. In the center of the ankle joint, between the tendons. Even that if we want to put the needle, we can put the needle. We want to do the acupressure or put the star magnet or put the some seed, we will see the balance. Let's take the one more last example, then you will able to understand it very clearly. The knee pain at the location of liver 8 will treat by the pericardium 3. Knee pain is very common. So whenever person is telling, okay, I'm having knee pain, we're asking, okay, tell me, where is the knee pain? Now, suppose person is telling you that I am suffering with the knee pain at this location. Look at this location. Person is telling you, I'm suffering with the knee pain in the liver 8 area. Person will keep the finger. Okay, he will not tell that I'm having pain in the liver area. He will tell I'm having knee pain in the inner side, in the medial side here. Okay, the inner side or the medial side. So we will point the area. So this is the exact painful area. Person is having pain here. If the person is having pain here at the liver 8 area, this is the liver. We can see the chart of the meridian, liver meridian is passing like this. So formula 1, 2, 3. Who is sick? Liver is sick. Who will treat? Resolve the matter within the family. Who belong to liver family? So we can see in this image, liver and pericardium belong to one family that is called zooin. Zooin. So if you want to balance the liver, it will be balanced with the pericardium. And if you want to balance the pericardium, it can be balanced with the liver. Okay, pericardium will balance. So the pain of the liver will be balanced by the pericardium. So look at here. If you look at the whole arm, how to do the image and mirroring? So this is look like hip joint. This is look like knee joint. This is look like ankle joint. Person is suffering with the knee pain. Will put the point here in the elbow area. Elbow area looking like knee joint. So we'll put the point here in the pericardium 3. Pericardium 3. Pericardium 3 will treat the pain of the medial knee area. So that's why when the person is telling you that I'm suffering with the knee pain, we always ask, can you tell exactly where? So just single point we can see in the elbow will treat the pain if you are, we can see here, the center of the elbow. So this is the location of pericardium 3, right? So this is the, in this way, just now we are discussing only the concept number 1 of Dr. Tan. And with the help of concept number 1, we have discussed multiple conditions. Finally, remember the 1, 2, 3 formula, right? 1, find out sick meridian, find out who will treat. And the concept number 1, image and mirror. Even there are more image and mirror concept are there. Even there are more added things are there, which I will add slowly and slowly. Memorize everything till today so that tomorrow we can go with the speed, right? So enough for today. Now we'll see you tomorrow on the same time. Thank you so much.